Hello, everyone. Welcome to our Career Pathways virtual career program. This month, we are featuring the topic of physical therapy, and I am pleased to welcome and introduce Hillary Metzger, who is a physical therapist here at ProHealth Care. I'm going to turn it over to Hillary to share a little bit about who she is, and her role at ProHealth Care. So welcome, Hillary.
Thank you so much, and thanks for having me. So as Sarah mentioned, my name is Hillary Metzger. I'm a licensed PT with my Doctor of Physical Therapy, and I work primarily for ProHealth Care at Oconomowoc Memorial Hospital, but I do also occasionally head over to Waukesha Memorial Hospital, so you'd see me both places. So you can go ahead. Yep, perfect. So as I mentioned, I'm a licensed PT with my Doctor of Physical Therapy, which nowadays is the entry-level requirement for you to become a physical therapist. So I know previously it was only a master's, or the education requirements have changed a lot over the years. And I know previous generations were grandfathered in with whatever degree they have, but now a doctorate is required. So my job title is a physical therapist. My department would be rehabilitation services. And I am specifically doing acute care here in the hospital setting. So as a physical therapist, you can work in tons of different settings. You can do outpatient, acute care, inpatient, and more of a nursing home setting. And what you're doing is going to vary greatly depending on what setting you're working in. So today I will speak specifically to the acute care or hospital setting. I've been a PT for about 6 years now, which is crazy. I've been with ProHealth Care for 2 years now as of December, so we're coming up on 2 years. And then before that, my first job right out of school was for Ascension, and I was there for about 4 years. In terms of why I got into PT, I feel like I don't actually have the typical story that most people do. I feel like most people that you talk to that end up becoming a PT have their personal injury story where they used to play sports and then they get injured and then they went for PT and they loved it. And that's what drove them to become a PT. I actually never had that. I knew I wanted to go into healthcare, but I don't love blood or surgery, or I just knew that wasn't my space. So I started shadowing different areas within healthcare, which is something I'd recommend you guys start doing too if you're interested in healthcare. I started with X-ray tech, ultrasound technician, and I really liked those things. But what I didn't like about it was you would do the X-ray or you would do the ultrasound and then the patient would leave. And I'd never know, how are they doing? What came of it? So somebody had recommended that I actually shadow a PT. And I really loved how as a PT, you get to see your patients multiple times. You get to know them. You get to know their family. It just really felt like more of an intimate relationship, and you could really see how you were impacting the patient in their lives. So that was ultimately what led me to be interested in PT. And then I really loved, specifically in the acute care setting, how much I get to work with different disciplines. So I get to work really, really closely with occupational therapists, speech therapists, nurses, doctors, case managers. I'll talk more about that later, but I really, really loved that aspect of it because I love working with people and being part of a team. And then lastly, I really, really like the work-life balance of being a PT, especially an acute care PT. I can come into work, do my work, and then I leave it here and I go home. And that's really big to me. I think work-life balance is really important. So that's my why. In terms of my education, I went to Carroll University, and they actually have what's called a direct admit program. I know some other schools in the area have this as well, but what that means is I actually applied to be part of the PT program when I was, I think, either a junior or a senior in high school. And if I met the criteria and they decided to accept me, I was actually guaranteed a seat in the graduate portion of the program. So to me, that was huge, just to know that I had a seat versus if you go to other schools that are non-direct admit, you usually have to do your undergrad portion. And then you would have to apply for the graduate portion, and there's a chance that you could get in, there's a chance that you might not. So I really liked Carroll overall, and I liked that they had the kind of guaranteed seat as long as I continued to meet the criteria to stay in the program. So there was a minimum GPA I had to maintain, and a minimum pre-professional GPA, which means just your sciences that I also had to maintain. But as long as I did those things, I was in. And it actually is an accelerated program. So most PT programs, you do your undergrad and grad in 7 years. Carroll University actually does theirs in 6. So that was obviously also attractive to me, and it's just quicker. It gets you out in the world faster, and it's less cost. So I really enjoyed the program. In terms of a day in the life on the job, my main responsibilities, obviously the biggest one is patient care. So a lot of my day is spent at the bedside working with patients. I'm either doing an initial evaluation, which means it's the first time I'm seeing the patient and I'm basically getting a feel for how are they moving, how are they functioning, what is their strength like, what is their balance like, what is their coordination like, all those things. Or I'm doing more of a treatment session where we've already seen the patient before. We're doing more treatment to progress them towards their goals that we establish during the initial evaluation. So some of the treatment, for example, that I would do is gait training. So teaching people how to walk, whether that's with a device or without. Therapeutic exercise, which is basically strengthening exercises. I feel like when you think of PT, that's what a lot of people think of. Therapeutic activities, this one's a little less common in the outpatient setting, but really, really common in the acute care setting. This is really focusing on function. So this is teaching people like how to get in and out of bed again, how to stand, how to do transfers, maybe from a bed to a wheelchair, kind of those functional tasks that sometimes I think we take for granted, but people might have a hard time doing after being in the hospital. And then neuro reeducation, which could be working on balance or posture or postural control, things like that. That's one that we would do a lot, maybe after like a stroke, for example. The next largest part of my day is documentation. So after I see any patient, I have to write a note. So these notes might include an initial evaluation note, a daily note, which would just be about my treatment. Sometimes if a patient had a change in status, they had a surgery or something that happened, we might re-evaluate the patient, or even just a discharge note if we're discharging a patient from our service. We do have some therapists that also attend rounds. So kind of that time where all the providers on one unit, doctors, nurses, case managers, come together to talk about the patients and their progress and where they're at. I'm not currently attending any rounds, but some of my coworkers do attend these rounds to give updates on patients and kind of fill the other providers in on how they're doing from a therapy perspective. We do also occasionally have CNA shadows. So there's certified nursing assistants that work on the units. And sometimes they actually will come with us and shadow one of our sessions. And then we do some teaching just about what PT or OT is, what we do. We can also teach them a little bit about patient handling techniques because they're working with the patients a lot during the day too. I also obviously have just some general department related responsibilities. We have meetings, maintaining our gym space, those kinds of things. There is some of the logistical scheduling things that I also need to do on a daily basis. So I might be scheduling an appointment for a patient for the next day. And then obviously there's a lot of communication that happens within the care team all the time, whether that be electronically, verbally, email, things like that. So those are kind of the biggest things I do every day. Oh, my favorite part of the job. I have a lot of them. Obviously getting to know my patients and their families. I touched on that earlier, but I feel like that's a really, really awesome part of the job. And it's definitely what attracted me to it. And it still does. Seeing my patients progress is the best thing ever. Knowing that I'm having an impact on their lives and I'm helping them, in this setting, I'm really helping them regain their daily function, which again, I think we can take that for granted sometimes. So that's an honor to be able to help people do that. As I mentioned before, I also really, really enjoy working with other people. I'm not really a go on my own type person. So I enjoy that every day I get to talk to nurses and doctors and case managers. And I learn a lot from my coworkers. It's really fun to be able to collaborate. And if we have, like, for example, a really complicated situation, to kind of pick their brains and learn from them and collaborate and work together that way. And just always learning. I don't know everything. I never will. And I enjoy that every day is different and it always teaches me something. And then in terms of the least favorite part of my job, we do have productivity, which just means we have to make sure we're billing a certain number of units during the time that we work every single day. And sometimes I think having to be conscious of that affects how you provide care. So it's just reality that we have to do that, but sometimes I wish it wasn't part of the puzzle. Also just limitations to my scope of practice. As a PT, I kind of have my scope of what I do and what I can help with. And I think sometimes you can see patients that are being affected by other things that are outside your scope and you wish you could help, but it's just not always feasible. And then insurance limitations. I feel like everybody knows that sometimes insurance approves certain things or denies certain things. And I think unfortunately, sometimes that can result in my patients not getting the care or the services that I ultimately think they would truly benefit the most from. So that can be frustrating at times. Equipment used. This one's pretty simple. When you think of the typical durable medical equipment, so walkers, canes, crutches, a hemi walker is basically a type of device that's like a walker, but on one side. So if somebody has an injury on one arm, they can still use basically like a walker. Wheelchairs, knee scooters. We also do use some lift devices, and the nursing staff uses these as well. So something called a Hoyer lift, which is a dependent lift, meaning the patient doesn't need to do any of the work. And then as therapy staff, we also often use sit-to-stand lifts, so to help a patient go from sitting to standing. If the patient is on oxygen, I'll have to use an oxygen tank. I also use a lot of monitoring equipment throughout my sessions. So telemetry is heart monitoring. A pulse oximeter helps me monitor their oxygen. And then obviously like a blood pressure cuff to keep an eye on their blood pressure during sessions. And then lastly, we have a therapy gym up here. So there's a lot of equipment in here that we might use, such as parallel bars. We have an elevating mat table and stairs. My schedule, I was actually previously full-time when I started with ProHealth Care, and then I had my daughter and decided to drop to part-time. So my part-time schedule is that I work Monday, 10:30 to 7. The reason that I start later and I end later is because here at Oconomowoc Memorial Hospital, we have a lot of orthopedic patients. So they have surgery, and then we try to see them day of surgery after the surgery. So to help cover those later surgery times, each of us stay later one day a week. So it's kind of a rotation, and we all contribute to that. And then Wednesday, 8 to 4:30, and then either Friday or Saturday, 8 to 4:30. It alternates each week, and it equals out to 2 Saturdays a month, which doesn't bother me. I actually kind of like the schedule. So it's either Monday, Wednesday, Friday, or Monday, Wednesday, Saturday. In terms of my holiday requirement, it's really just one major holiday per year, which isn't bad at all. So and it's a rotation. So it might mean Christmas one time, but then I wouldn't be up for Christmas for quite some time after that. And then occasionally you might have to work a holiday weekend, just depending if my Saturday falls on a holiday weekend, but not always. So that just depends. The patient population that I see here is a lot. We see a lot of different stuff, but our biggest one here at Oconomowoc would definitely be orthopedic patients. We do also see patients with neurologic diagnosis, such as like a stroke or a TIA, a lot of pulmonary diagnoses, such as pneumonia, COPD, and then some cardiac diagnoses, whether it's an irregular heart rhythm, they may have had a cardiac procedure. We see a little bit of everything. And there is also oncology at Waukesha Memorial. I forgot to put that on there. So cancer patients, we might also see those as well. In terms of the age of my patient population, it is mostly geriatric, so like 70 plus, although we do occasionally get some more middle-aged patients. I very rarely see a patient that's younger than probably about 50. So that's my population. And then in terms of the number of patients we see per day, if it's about an 8-hour shift, we would aim for about 8 patients. But that can vary greatly. If I have a day where my patients just need longer sessions and are requiring more of my time, I would see less patients that day. And we kind of have to prioritize and work through that. Versus if I have a day where all my sessions are pretty quick and easy and straightforward, I probably could get through 8 in a day. So it just depends. The interdisciplinary team that I work with, primarily the people I work closest with would be the other professionals within the rehab department. So occupational therapists, speech therapists. We do also have some rehab aides, which are people that we can call and they can help us with equipment or with a transfer or moving the patient. So basically just an aid to help us during our session. We obviously work with medical doctors. That can include a hospitalist, which is kind of the person that almost serves as like your primary care doctor while you're in the hospital. We do also have specialists, so cardiologists, neurologists, things like that. And intensivists, which would be critical care, so more of like an ICU doctor. We do also obviously work with physician assistants and nurse practitioners, which are basically like assistants to the doctors. Most of our communication actually happens with those assistants and practitioners versus the doctor themselves usually. Nurses, CNAs, we do a lot of work with them on the floor with patients every day. And then case managers, social workers, they're kind of the discharge people. They make it happen. They take our recommendations and they make them happen. So we work really, really closely with them. Occasionally, I will work with respiratory therapists if I have a patient that's on oxygen and I need to kind of pick their brains about that. We do also have spiritual care here in the hospital, which is a really great service if we have a patient who would benefit from spiritual care, prayer, or just a company or a companion. She is willing to go in and sit with them and talk with them and pray for them if they'd like. And then I do occasionally also work with our palliative or hospice care staff, so more of like an end of life type situation. And that's usually if our efforts have kind of failed up to this point and the patient's not progressing and they ultimately decide to choose more of a comfort route to their care. We will occasionally collaborate with those staff. In closing, if you are thinking of going into really healthcare in general, but I guess I can speak specifically to acute care physical therapy, the most helpful skills I think to have is, obviously communication. I'm communicating all day long. And I put various types and levels because I don't just necessarily even mean verbal. I think there's verbal, nonverbal, there's written. I've also had to communicate at very different levels. I've had patients who are extremely educated and knowledgeable, and then I've had patients who actually can't read or write. So I think just having a variety of different ways to communicate, not only with your coworkers or fellow staff members, but also with patients and their families is really, really important. Especially here in acute care, I just feel like I'm communicating all day long. I think in acute care specifically, again, being self-driven is really important because I actually don't have a schedule. I have a patient list, but how I move through that list during my day is my choice. So it's kind of up to me to decide what's going to be the best way to tackle my list, what's most efficient, what's best for my patients. Kind of along those lines, I think you do need to be organized. I think that's for most jobs that would be helpful. Time management, so making sure you're managing your session times accordingly and you're billing appropriately for the time you spend with the patients, as well as ensuring you have enough time to do both your treatment and your documentation. So it's kind of a balance of both. And then obviously clinical reasoning, so just having that baseline knowledge and skill set to give your patients the care that they need and to reason through those difficult situations, which that's going to come with just being in school and doing clinicals and practice. So those are big skills. And then in closing, why I enjoy working for ProHealth Care. I think it's really awesome that ProHealth Care is still, as of now, an independent organization. So in a healthcare climate where a lot of healthcare organizations are being sold or purchased to larger or there's a lot of mergers and things happening, ProHealth Care is one of the few independently standing ones still. And I just think that's really cool and allows us to do some things that other systems can't. For example, when I actually was working originally at my previous job, it was Wheaton Franciscan, if anybody's heard of that. And while I was there, they got purchased by Ascension. So I've actually had the firsthand experience of going through that. And I really enjoy now being at an independent organization. I also love that ProHealth Care is very community oriented. You'll see them out and about in the community a lot. I know they just did some cardiac something. I was not there, but it was it almost sounded like a Relay for Life type thing, but for something cardiac. But my favorite thing we do in the community is there's actually a really big garden at Waukesha Memorial Hospital where they grow food and then they donate it to the community. And I know they just posted they donated like a really cool, huge amount of food to the community. So I just think that's really cool. And you can actually go sit in the garden while you eat, or near the garden when you eat your lunch and look at it. It's really cool. I also love that they're focused on patient-centered care. That's kind of one of the hallmarks of ProHealth Care. And obviously it's what drove me to get into PT. So it just makes sense. It's a good fit for me. We do have a strong sense of community, especially at Oconomowoc here, because Oconomowoc's smaller than Waukesha Memorial, quite a bit smaller. So I really know all my coworkers and nurses and doctors, and so that's really cool. I also love that everybody here is pretty collaborative. Everybody's open to ideas and welcoming the idea of working together, and I enjoy that I get to do that on a daily basis. And I have a really awesome manager, which makes it everything at a job. Like, it's really important to have a good manager. So I'm very thankful for that. But that's all I have for you guys today. So I hope that helped, teach you a little bit more about acute care physical therapy specifically, because again, I think what I do is extremely different than what like an outpatient physical therapist might do at a clinic. And I think when you think of PT, most often people think of outpatient PT, which isn't a bad thing, but I hope maybe I helped shed some light on another option for you. So thanks for your time, and I hope you enjoyed.